Well, for more on how hospital funding works, I spoke to Dr. George Benjamin. He's the executive director of the American Public Health Association. I began by asking him to explain how the various hospital models operate here in the U.S.
You need to think of our hospitals in three ways. First of all, we have hospitals that are funded by the federal government 100%. So think about our veterans hospitals, our military hospitals, and then at some state and cities have big public hospitals. And these hospitals are funded by public dollars, almost, particularly. And then you have two kinds of hospitals in the private sector. One are nonprofits, and the other are for-profits. And what that means is basically their tax status. They function just like any of the other hospitals, except the for-profit hospitals are investors. So people invest, they trade those dollars in the private sector, just like stocks and bonds. And that's private dollars that go into those hospitals. And then you have the regular hospitals, the nonprofits. And they're given some preferential tax status. They don't pay as much in taxes because their dollars are supposed to be for the public good, and they go back into the institution. Now, the truth of the matter is that all three models bill private insurance to some degree. So there are private dollars that go in because people in the United States have health insurance coverage as their primary way of paying for health care.
Now, one of the things that we're seeing is being exacerbated by the pandemic. We've seen with community hospitals like Roseland in Illinois. Where does the funding for some of these community hospitals come from, and how sustainable is it?
Well, the challenge is that these hospitals are always working on a margin of about 2 to 3%. And they have to take anyone that comes in the door, particularly the nonprofits, hospitals. And so there are many Americans, unfortunately, the United States is a country that does not have universal health care coverage for all of our citizens. And so everybody pays a little bit of something. So I have private insurance, and my private insurance rate is a little higher than it would be if all citizens were covered in order to pay for the uninsured. However, some hospitals are in communities that are so impoverished or have so many people that are uninsured that the federal government gives them some additional money to provide services for those hospitals and those patients.
And I want to also talk about how the funding differs when it comes to rural hospitals versus hospitals in major cities. Is there a major difference?
The biggest issue in rural hospitals versus our big urban hospitals is size and capacity. So if you think about it, if you're in a small rural hospital, say 15 or 20 beds, that's a very small hospital. And so that if you have a fairly large number of people that are lower income, then your ability to sustain that hospital, which has to still have an intensive care unit and specialized doctors and nurses, is really a challenge. And so the federal government gives them a little bit extra money, but in something like COVID or one of these big outbreaks like we have right now, that amount of money is just not enough.
And we have seen that elective surgeries and routine care appointments were either put off because hospitals couldn't take them because they wanted to focus on COVID, or patients themselves they were scared. They didn't want to come into the hospitals. What sort of medical services really tend to make up the bread and butter of revenue when it comes to a hospital's bottom line?
Yeah, that's the interesting thing here is that, so I was an ER doctor for much of my clinical career. And much as I love emergency medicine, it doesn't pay the bills. What pays the bills are replacing your hip when you need a hip replacement. It's about taking your gallbladder out. If you have an appendicitis and have to take your appendix out. It's the routine elective plastic surgeries that do occur in the hospital or with facilities linked to the hospital. That's what pays the bills. That's what keeps the hospital going. These other types of things where you have a lot of really sick people are for a smaller number of patients, and we're very, very expensive when we get really sick.
And we have seen that there have been layoffs. It does seem counterintuitive during a health crisis, but there have been layoffs of doctors and medical staff, and you've also seen a number of hospitals filing for bankruptcies this year. Were these already growing trends before the pandemic, or is this something that has really been as a result of the pandemic?
Well, hospitals have increasingly been stressed as we've tightened up the amount of dollars available for hospitals. and health systems. The challenge is that when you have such a serious global pandemic like this, it truly stresses the whole system. And, you know, hospitals, frankly, have to pay their bills. And not enough money, they cannot stay in business.